Learning English with English faculties.
Welcome back. And this section, we will write the body of the letter, writing the body. Paragraph by paragraph, we will write this. So we'll start with the topic, writing the body. Okay. The OET guide tells us that the purpose is the very first criterion your letter is assessed on. And it has two basic parts. One of the first things that your examiner will look in your letter, 2 points. Now, the first one is called immediately apparent. Apparent. Now, what does this mean? Immediately apparent means the reason for your letter. And that reason must be crystal clear from your very first sentence. So, crystal clear reason why you are writing the letter. Okay, this is immediately apparent. Part 2 is called sufficiently expanding. Okay. So part 2 is called sufficiently expanding. Now, this means your final paragraph, the last paragraph, must go back and give specific additional details about why you are writing and what exactly you need from the writer. Okay. So, final paragraph should go back and give details, right? Specific details. I'm going to just write specific, and additional details. Additional details about why you are writing the letter and what exactly you need. Why? Let's say why you are writing. One, you are writing and what you need. Okay, from the reader. When we write the letter, step by step, when we start writing the letter, you'll get a clearer, more clearer picture of this. Now keep these two parts in mind as we write. Now let's go and write our letter paragraph by paragraph. Now paragraph 1, so we'll say para 1. Okay, this is opening. And this is purpose part 1. So remember, this is purpose part 1. Okay? You can say, I'm writing to refer Mr. Michael Johnson, a 42-year-old IT professional, for urgent neurosurgical assessment and management. So let me write this. I'm going to speed this up a little bit. Now, let me explain the choices here. The OET guide confirms that writing, I am writing to refer, is appropriate when the task is a referral letter. We include the word urgent because the writing task specifically asked for urgent assessment and treatment. Always use the exact language from the task instruction. We include the patient's occupation, that is an IT professional, because it personalizes the letter to this specific patient. The OET guide specifically warns you not to use pre-learned phrases without personalizing them. You can use pre-learned phrases, but you will have to personalize them. So in this case, we have mentioned his profession just to personalize them. Every sentence should reflect this particular patient situation. So everything that you are writing should reflect this person or this patient's situation. So this was your paragraph 1. Now let's go to paragraph 2. Okay. Now paragraph 2 is the medical history and past history. I'm going to write this and I'm going to speed it up so that you don't have to wait for me to complete the writing. Okay, so I have written the paragraph 2, which reads as Mr. Johnson has presented with a 2-week history of persistent headaches and blurred vision. One thing you should remember is that please do not use was here. It is has. So Mr. Johnson has presented. I've seen a lot of people writing was here. So it should not be was, it has to be has. Mr. Johnson has presented with a 2-week history of persistent headaches and blurred vision, with no history of recent trauma or fever. Full stop. His past medical history is significant for hypertension, currently controlled or managed. You can also write managed, currently controlled with medications. Notice what we have done here. If you remember, the case notes simply said headache and blurred vision, right? And then past 2 weeks. Let's just have a quick look at it. It says headache and blurred vision past 2 weeks. We have expanded that into a proper professional sentence. This is exactly what the OET guide means when it says to expand the notes into complete sentences. They will give it to you in points. You have to make the sentence out of it. We have also grouped the medical history and past history together in one paragraph because they're related background information. Again, the OET guide specifically identifies not grouping similar information as one of the 3 mistakes that will cost you marks. So make sure to group the similar information together. OET can penalize you. OET can take your marks. The examiners can cut your marks based on one of the criteria called conciseness and clarity. Always group similar information together. So we have done para 1. We have done para 2. Let's move to para 3. Now, para 3 is for assessment findings. And let me write this and I will speed this up so that you don't have to spend the time with me. So I'm going to write it and I'll speed it up. So I've written, on assessment, Mr. Johnson appeared distressed due to severe headaches. While his vital signs were within normal limits, his blood pressure was elevated. Fundoscopic examination revealed papilledema with no focal neurological deficits noted. Now, a few things to notice. The phrase on assessment is a clean, professional way to open the paragraph. It signals clearly to the reader that you are not describing the clinical findings. We use the word while. if you see in here, we use the word while to create a contrast. Vital signs were normal overall, but blood pressure was elevated. Usage of words like while and however, that is one of the criterion OET examiners use to check how good you are with the language, specifically grammar and how you connect your ideas. Also notice that we have accurately represented the case notes. The notes said papilledema on fundoscopy. It did not mention the entire thing. So we wrote that, if you see, this is what we have written. And we have made it into a sentence. We have said fundoscopic examination revealed papilledema. We did not change the meaning. We simply expanded the phrase into a full sentence. And OET guide is very clear when it comes to this thing. It is very clear. Changing the meaning of the case notes, even accidentally change the case notes, even things like he and she, if you change from he to she and she to he, will affect your content score. So please be very careful with that. Now let's go to paragraph 4. Paragraph 4 is about investigations and diagnosis. Investigations and diagnosis. Now I'm going to write this again and I will speed up so that you don't have to wait. Okay, so I've written in paragraph 4, investigations showed no acute abnormalities on CT scan of the brain. However, and you need to use a comma after you put however. However, MRI of the brain identified a large intracranial mass in the posterior fossa, leading to a diagnosis of a posterior fossa brain tumor. This paragraph contains the most critical clinical findings in the entire letter, the MRI result and the diagnosis. So we placed it prominently as the OET guide instructs the OET parameters that they have for this letter writing, instructs the most important information should come first in the paragraph while supporting details following after. So whenever you write it, remember this one rule that the most important information that you're putting there in the paragraph should come in the beginning of the paragraph, okay? And the remaining paragraph should be the supporting details. And the linking word here Let me highlight this. So the linking word, however, creates a clear contrast between the CT scan result, which was normal, and the MRI result, which revealed the tumor. And this contrast is important because it shows the reader exactly how the diagnosis was reached. And on abbreviations, now, this is something that I wanted to say. If you go with the OET guidelines that they have for writing, CT and MRI are acceptable abbreviations. So we have used CT and MRI because they are more commonly known than their full forms. And it is not going to make any difference because medical professionals actually know MRI as MRI, even to non-specific readers. So even people who are even if a common person, if somebody not so familiar with medicine, even he or she would understand what an MRI is or what a CT scan is. So you don't have to expand it. You can write the abbreviations and OET accepts that. Now, let's go to paragraph 5. And paragraph 5 is management and plan. Management and plan. Now, once again, I'm going to write this. I will speed it up in the video and then we will read it. So let me write it. Okay, so I have written medications have been prescribed to manage his headaches and prevent complications. The planned management includes surgical resection of the tumor, followed by radiation therapy and chemotherapy as indicated. Full stop. He will be monitored closely for any changes in symptoms and response to treatment. This paragraph covers both what has already been done, that is, medications prescribed, and what is planned, that is, surgery, radiation, chemotherapy, and then again after that, monitoring. Now, what we have done in here is that we have grouped these information together because they both fall under the theme of management, what has been done and what is to be done. This is the thematic approach to organizing the OET letter in the manner that OET recommends. The group information by theme rather than repeating it in different places. So group the information by theme and do not repeat at different phrases. The phrase that I have used in here, and that is as indicated, means clinically as required. It is an appropriate clinical phrase that avoids overstating what will definitely happen. So we are not saying this is what is going to happen, but as indicated, we will proceed, or as indicated, or how it is planned, we will proceed. Para 6 is the closing paragraph. This is purpose part 2. If you remember, we were discussing about 2 purposes that you have to take care, you have to ensure that you meet. One is immediately apparent and sufficiently expanding. So this last paragraph is about sufficiently expanding. Okay. So this is the closing paragraph. So we'll write the closing. Okay. And this is purpose 2 or purpose part 2. Okay, now let me write this. And as always, as usual, I will write this, I will speed it up, and then I will read it. All right. So in this paragraph, what I have written is that in the light of the MRI findings confirming a posterior fossa brain tumor, if you don't write this, it is okay. But because one of the rule in OET guidelines mentions very specifically to sufficiently expand, and the final paragraph should be specifically giving additional details or specific details why you are writing and what you need to inform, what you need from the reader. It is advisable to, write it this way. In the light of MRI findings confirming a posterior fossa brain tumor, I would be grateful if you could urgently assess Mr. Johnson and advise on surgical resection. Wes, there is a difference between ADVISE and ADVICE. This is something that you need to look up in the dictionary and find out the meaning, where to use ADVICE and where to use ADVISE. Okay. Advice on surgical resection, and the need for subsequent radiation and chemotherapy. And then I have added a line: please do not hesitate to contact me if you require any further information. This paragraph is critical, and many students forget about it or treat it as just a polite goodbye. It is not. It is not. The OET guidelines very clearly state that the closing paragraph must sufficiently expand reason for writing by providing specific and additional details. In other words, do not just write, please contact me if needed, and stop there. You must tell the doctor specifically what you are asking them or him to do. In our case, we are asking Dr. Hagrid to urgently assess the patient and specifically advise on the surgical and oncological management in here. This is personalized to the patient's situation. Now, this is also personalization. You can learn the format, but personalization you have to do according to the patient. And this is personalized to this patient's situation, not a generic closing. The phrase, that is the last phrase in here, please do not. Please do not hesitate to contact me if you require any further information, is confirmed by the OET guidelines itself as an appropriate closing expression. So you can write that. I have been asked questions by professionals going in to write OET letter that whether this should be given. But this is actually an accepted closing expressions from OET itself. And you can also write, thank you for your continued management for this patient. And that is fine. You can also write, thank you for your continued management for this patient. So you can also write that, and that is accepted. Now, what I'm going to do is that I'm going to bring all this paragraph that I have written into one page and see how it looks. Okay, so I was able to put every paragraph onto one page, and this is just the body of the letter. You need to put other details like to whom you are writing, the date, the salutation, the RE line, the regarding lines, and everything you have to put. So I have just compiled every paragraph that we had on other pages. I put it on one page and just read. Let's just read it. I'm writing to refer Mr. Michael Johnson, 42-year-old IT professional, for urgent neurosurgical assessment and management. Para 2. Mr. Johnson has presented with a 2-week history of persistent headaches and blurred vision, with no history of recent trauma or fever. Full stop. His past medical history is significant for currently. Is significant for. Okay. When I changed, I think when I changed it, um, when I was trying to drag this thing, it altered the layout. Significant, so it should be significant for hypertension. I'll just write it here. Hypertension. And then it was, I had written currently controlled with medication. So, comma, currently controlled. Make sure that you don't write capital letters in between. Okay? Controlled with medications. All right. Okay. Then on assessment, Mr. Johnson appeared distressed due to severe headaches, comma, while his vital signs were within normal limits, comma, his blood pressure was elevated. Endoscopic examination revealed papilledema with no focal neurological deficits noted. Then we went to paragraph 4, where we wrote about investigations and diagnosis. Investigations showed no acute abnormalities on CT scan of the brain. However, MRI of the brain identified a large intracranial mass in the posterior fossa, leading to a diagnosis of a posterior fossa brain tumor. Then we come down to paragraph number 5, which is management and plan. And we say medications have been prescribed to manage his headaches and prevent complications. The plan management includes surgical resection of the tumor, followed by radiation therapy and chemotherapy as indicated. He will be monitored closely for any changes in symptoms and response to treatment. Then it is para 6. Somehow this thing has moved up. Let me just try and see if I can move it down to, okay. That worked. So para 6, in the light of the MRI findings confirming a posterior fossa brain tumor, I would be grateful if you could urgently assess Mr. Johnson and advise on surgical resection and the need for subsequent radiation and chemotherapy. Please do not hesitate. So it is please do not hesitate to contact me if you require any further information. And then you need to add in here something very important is yours sincerely. This has to be small at all time. And nurse in charge. And then you mentioned from where, Collinsville Hospital, Australia. There's not enough space for me to write, so somehow I'm managing it. Australia. Remember to write the hospital name with capital letters, and Australia A should be capital. Now, this is a professionally written OET referral letter. The body of the letter is approximately 200 words, all body paragraphs, excluding the ones in red that I've written. Everything else should be close to around 200 words. The header, the date, the salutation, the RE line, and closing line are not included in that word count. And this is how you should write a standard OET referral letter. I will give you a similar assignment, a similar letter. So I would want you to go and try writing that letter. And before I finish I would like to mention a few things which are important, and I want you to know that every single one of these points are from OET writing guidelines from OET websites. These are not my personal opinions. These come from OET itself. Number one, all 6 assessment criteria carry equal weight. Okay, so there are 6 assessment criteria. I have a video which you can check for these assessment criteria. So all 6 assessment criteria carry equal weight. The OET guide says this directly. Accurate grammar is important, but not more important than any of the other criteria. Many students focus only on language and grammar, but purpose, content, conciseness, and clarity, genre and style, organization of the letter, all are criteria and all of these matter. You have to perform well across all 6 if you want to get good grades. Number 2, personalize every section. You need to personalize every section. You can learn the format, but when you write it, make sure it is personalized to the patient you're writing for. Okay, let me put this in points, so that you get these. So the first one is criteria. All the criteria uh, is assessed equally. Second is personalize. Third is your letter should be 180 to 200 words. It is not a strict rule, to be honest to you. OET, their guidelines confirm that OET resources, if you go to OET, resources, it says somewhere that OET assessors do not count your words, right? If you go slightly over, and if you have covered all the relevant content well, that is not penalized. What is penalized is missing important information or including irrelevant information. If you do that, you will be penalized. Okay. Uh, Number 4 that I would want you to take into account is contractions. Now, again, OET is very clear about this. Do not write things like, he's or didn't. Don't do this. Didn't or is apostrophe s's. Always write the full thing. If you have to write he is, write he is. Did not or she is. Write it this way. Do not do contractions. Contractions are informal and will affect your genre and style score. Then the tip number 5, your closing paragraph must do real work. A lot of times students don't pay heed or any attention to the closing paragraph. They'll simply write, if you need any further information, please do not hesitate to contact me. But do not treat this as a polite goodbye space. It must specifically expand on what you're asking the reader to do. Make it personalized and clinically specific. Okay. Number 6, during the 5 minutes of reading time, you cannot write anything. The OET rules state that you may use the time only for reading, and you cannot even touch a pen or pencil during that time. Please use this time to read the case notes and read it at least twice. A deep breath, start reading it at a slow pace. Do not run through it. Read those case notes to understand it. You are a medical professional. You know what is there. So read it twice if you get the time done. Number 7, I would say, if you finish writing this letter early, use that to proofread. Now, a lot of my students, I train them in a way that they are able to write this letter in 25 to 30 minutes. Okay. And when they write this in 25 to 30 minutes, I ask them to proofread as a reader, not as a writer, as a reader. Read the letter that you have written as someone who is going to receive the letter, and ask yourself, once you read it, imagine you are the person who you're writing. So imagine in this was Dr. Hagrid, and think, do I have the clear understanding of the situation? Do I know everything I need to know about this patient? And are the facts, everything in here, are they relevant? That is what I require. Do I have any irrelevant facts? If you can answer all of these questions, your letter is in good shape. Your letter is good. And that's it. We have now written a complete verified OET standard nursing reference letter together. I have walked you through every single decision, the format, the paragraph, the language, and the criteria. If this video has helped you, please give it a thumbs up. It genuinely helps more students find this content. And you can subscribe to English faculties if you do not want to miss our upcoming OET preparation videos. We will be bringing in letters which our students are writing, and we will be checking them in the coming videos. So this is the first time I'm explaining referral letter. From now onwards, I will check referral letters. And please leave your questions in the comments below. I do read every single one. Good luck with your preparation, and I will see you in the next video. Take care. God bless.